You have hip flexor tendonitis? Well, today's video is for you. We'll be going over some exercises to promote recovery. Keep watching. If you're dealing with hip flexor tendonitis, it's affecting a small group of muscles in the front of your hip. So hip flexion, just so you know what it is, it refers to being able to lift your thigh up. So this is hip flexion. Hip extension is the exact opposite, where my thigh is going back behind my body. So the muscles that are responsible for lifting my hip into flexion are the ones that are going to be affecting hip flexor tendonitis. Now, hip flexor tendonitis is a very broad term, and it can refer to any of your hip flexors, and there are multiple hip flexors. But for the purposes of this video, we'll be specifically talking about the iliopsoas tendon. Now, the iliopsoas tendon is formed between the two tendons of the iliacus found in the pelvis and your psoas major found in the abdominal region. Now, your psoas major and iliacus, they'll join together to form that tendon just right before it inserts into your femur. The reason why we'll be focusing on this group of muscles, or these two muscles in particular, is because these are the two major hip flexor muscles. They are largely responsible for most of the hip flexion that goes on in the body. So we'll be targeting this muscle group specifically. Some other muscles that can contribute to hip flexion are the TFL, you have your rectus femoris, but these muscles are a lot weaker in hip flexion compared to the psoas major and iliacus muscles. Some things that you need to know about tendonitis to set some expectations on how long it takes to recover. Now, depending on the severity of your tendinopathy or tendinosis or tendonitis, and I'm going to use these terms very interchangeably for the purpose of this video, is that it could take anywhere between 3 to 6 months of recovery, and that's with rehabilitation. If you're not really doing anything to strengthen the tendon itself, you're not really going to see much relief. This can last for a very long time if you're not doing anything to address it. The types of exercises that we'll be doing particularly are going to be strengthening based exercises, and this is so that we can stimulate some positive adaptations within the tendinous junction. During these exercises, pushing through a tiny bit of pain might be expected. We really want to limit the amount of pain to less than 2 out of 10 pain. We also want to really make sure that you're not going to be flaring up your symptoms after you're done your rehab program, which means that you have no lingering soreness that lasts for longer than 2 hours and you don't feel worse the next day. If you don't have access to a band, but you do have access to a gym, you can also use the cable pulley machine instead, as long as you're using an ankle strap and using that on your foot. All right, so this first exercise doesn't really use any equipment at all. You can use the yoga mat to sit on a cushioned surface, but even then you don't really need it. What you do need is a wall and some clear space around it so that you're just not overcrowding yourself. So first, I'm going to just sit right up against that wall, make sure my pelvis touches the wall, and I'm going to be stabilizing my whole entire lumbar spine against it. You can have a bit of a curve in your low back as well. That is fine to do. For the purpose of this video, I'll be targeting my right side of my hip. If your injury is on your right side, you could just kind of copy me what I'm doing. If it's on your left side, then just do it on the left leg instead. So right now, I'm going to place my non-target leg, my left leg, my healthy leg over here. I'm going to have it bent just so that I could put my lumbar spine into a bit more flexion. Okay, and that's just going to stay stable there. From here, my right leg is going to be nice and straight, and what I'm going to be doing is lifting this as high as I can without letting my back come off of that wall. And this is because we want to isolate the movement into hip flexion only and not lumbar flexion. We're using a wall to block our lumbar movement so that we can more effectively target our hip flexion end ranges. Okay, so from here, you can just lift your leg up as high as you can. As you can see, I don't really clear the ground that much. If I'm doing this properly, and I'm not cheating, I'm only gaining my heel about an inch above the ground. I'm gonna hold this for up to 10 seconds, and then you're going to come back down. So you're gonna feel this in the quadriceps a lot. You're going to also feel it in the hip flexor as well. But we'll be training the whole entire anterior chain as a group together. Once again, I'm gonna go again after about 5 to 10 second rest. I'm gonna do another 10-second hold. And as you can probably tell from my breath, I'm bracing quite hard in order to get this leg as high as possible. So the important thing is not that you're lifting the leg, is that you're doing max effort to lift it as high as possible. And we're going to be doing about 6 repetitions of this. So this is rep number 3 for me. Hold, up to 10 seconds, or for as long as you can before you fatigue, and then back down. Now, once again, if you're feeling some pain, then maybe just don't lift it as high, or just decrease the duration that you're holding it for. If you can't do 10 seconds yet, don't worry. Over a period of days to weeks, you could build up to this rep range in terms of how long you're holding it for. So here we go, number 4, holding that again, knee nice and straight, ankle could be tilted forwards or backwards, and then back down. The ankle positioning doesn't really matter for this exercise, so just do whatever's most comfortable. For me, having my foot in neutral is the most comfortable. So I'm gonna do one more. This is only my 5th rep, but I think you guys and girls probably understand the gist of what we're trying to do here. And then back down. Okay, so next we're going to do another exercise. For this exercise, we're going to need something like a band anchor and a band. I'm also gonna have a yoga mat as well. All right, so this is the monster band I was talking about, but once again, if you don't have a monster band, you could try using a regular band as long as you can loop around your foot, or use a cable pulling machine if you're at the gym. So from here, I'm gonna anchor it to anchor point that's about knee height-ish, give or take a few inches. From here, I'm going to pull the band so that there's a bit of tension on it, and then I'm gonna loop it around the top of my foot here. And then I'm going to just lie down on my back. The left leg, you're gonna have just flat on the floor. Right leg, you're gonna have in the air. From here, you're going to bend the knee and pull that knee into as much hip flexion as possible. So I'm gonna pull it as high as I can, and I'm gonna maintain this hold for up to 10 seconds. Once again, taking advantage of a time under tension principle that will help to stimulate better adaptation in the tendon, and then coming back down to a release position. And we're going to rest for about 5 to 10 seconds. And then once again, we're going to go again. If you need, you could use your hands on the floor to just add some more stability. You'll pull that hip up into as much flexion. Try to get that knee to reach your chest, making sure you're not actually curling your back. So you want to have a natural curve in the low back here. Hold. And as you can tell from my breathing and bracing, this is actually quite difficult to do because it is effort-based. Now, if you can't reach max effort because of the pain, that is fine. Just go as hard as you can. We do want to make sure that you're going to work within your tolerable rep range. We don't want to resensitize your tissues. If you find that the red band that I'm using, which is the lightest monster band you can use, is a little too easy, you can always use a thicker band or just go slide a little further away from the anchor point. This is my 3rd repetition here. I'm going to be pulling that knee up. Now you can see my foot is in ankle dorsiflexion, and that's just so I can maintain the band. If I go into plantar flexion, this band will slip off my foot. And then I'm pulling as high as I can, and then I'm coming back down. All right, so we're just going to do one more repetition for the sake of this video so you got the form down. Other than that, when you're doing this at home, you're going to be aiming for anywhere between 6 to 8 repetitions, 10-second holds, 10-second rests in between. You're going to be doing 2 to 3 sets, 2 to 3 times a week. Depends on what you can tolerate. You can always start with less in your first few weeks. And like I said, this is going to be a 3 to 6 month process. So taking it a little slow in the beginning, just to make sure you're not flaring up your symptoms, is a smart idea. You're going to be needing to take advantage of how long it takes in terms of your recovery. So there's no rush to trying to get this better. As long as you're consistent and you're being smart about your rehab, things can get better. This is the last repetition here. I'm going to hold it for up to 10 seconds and back down. All right, so that completes the 2nd exercise. All right, we're going to go on to our 3rd and last exercise for this early phase programming. So the last exercise that we'll be doing, we'll be using a loop band. Make sure you want to use a yoga mat. I'm going to be also using push-up grips just so I have more comfortable wrist positioning. But basically, you'll be going into a tall plank position. So if you're okay to tolerate your hands flat like that, you could do that. I'm going to use push-up grips just because it's a little bit more comfortable. But let's get started. So we're going to take this loop band and we're just going to put it around your feet. Your feet, not your ankles. This is so that they don't slip. From here, I'm going to go into this tall plank position, which just resembles being the top of a push-up. From here, I'm going to take my right leg, because I'm targeting my right side, and I'm going to pull that knee up to my chest. Now, I want to try to maintain as much of a neutral spine as possible. I'm going to hold this for up to 10 seconds. I'm going to be shaking a little bit, because this is going to be training your core with your hip flexor at the same time, and then you're going to come back down. Now, you can rest for 10 seconds in between sets, or you could just train the other side if you want. So I like to just kind of train my good side. And you'll actually notice that while you're in this position, you'll still feel that hip flexor stabilizing in this extended position. So it's actually quite beneficial to train your other side as well. Coming back down, and then you're going to do another 10-second hold. We're going to go for up to 3 to 6 repetitions here. So of 10-second holds. And as you can see, it's a lot harder than it looks. Pulling it up, pull it up as high as you can, max effort. And then back down. So after about 3 repetitions or so, you could rest for about a minute to a minute and a half. You want to make sure you take full advantage of that rest by not cutting it short. And this is so that you could do more effective second set. You want to be fully recovered when you do your next set, just so you could also get high quality repetitions again. So we're going to go for another set. Now, when it comes to this exercise, or any of the exercises that we mentioned, I did make a few recommendations on how many repetitions you want to hit. But if you find that you start getting some pain sensitivity or you start fatiguing early because your muscles are deconditioned, it is fine to complete that set short. So what that means is, for any of my exercises, say I was doing 10 repetitions on my first set, my second set I do 5 repetitions, and the third set I do like 2 repetitions even, that's completely fine. You're in a process where you're trying to slowly level the body up. So what you'll do is after about 2 days of rest, you'll be trying to do those 3 sets again. You're just trying to beat those numbers. So really you're just trying to make sure you get those small incremental gains on a week by week basis, because it does take some time for your body to naturally recover. For this exercise, it tends to be on the higher difficulty setting. It's fine that if you only get like 1 or 2 reps out for the second set, or even just 1 rep out on the third set, just because you're fatiguing. When it comes to doing these exercises, even though it takes about 3 to 6 months for the tissues to fully recover and become fully functional, you should notice some week to week improvements, whether that be decreased symptoms, decreased stiffness, increased strength. You should notice some incremental gains on a weekly basis. If you're not really seeing those gains, the condition that you're dealing with might not be what you think it is. So it's really recommended at that point to get assessed by a healthcare professional. You can see a sports chiropractor or a physiotherapist to address these issues. If you're in Toronto or Markham, you can come to the Rehab Hero Clinic and book a visit and get assessed by one of our healthcare experts. If you have any questions regarding what you watched in this video, let me know in the comments below. If you haven't yet, please hit subscribe, and I'll see you all next time. Peace.